You feel healthy. That's what makes this so important. You wake up in your own bed. You make your coffee. You go through your normal routine. Maybe your energy isn't exactly what it used to be, but overall, life feels stable. Then one routine doctor's appointment changes everything. A test gets ordered just to be safe. The test finds something small. That leads to another scan, another appointment, another specialist. And suddenly, a person who felt completely fine is now living inside a cycle of hospitals, medications, procedures, and anxiety. And according to growing medical research, this is happening to older adults far more often than most people realize. Not because doctors are bad, and not because medicine doesn't help people, but because after the age of 70, the balance between benefit and risk begins to change. A procedure that helps a healthy 50-year-old can affect a 78-year-old body very differently. And many older adults are never fully told how much that equation changes with age. Today we're talking about 5 routine medical checkups many experts now believe should be approached much more carefully after 70. We'll look at what the research actually says. We'll talk about the hidden risks. And we'll discuss why some screenings designed to protect health may sometimes reduce quality of life instead. Because sometimes the wisest medical decision is not doing more. Sometimes it's knowing when enough is enough. The first checkup is routine colonoscopy after age 75. Now, to be clear, colon cancer screening absolutely saves lives. For many people, it's incredibly important. But age changes the equation. The United States Preventive Services Task Force now recommends against routine colonoscopy screening in many average-risk adults over 75 because the risks begin increasing while the benefits become smaller. And those risks are real. Research published in JAMA Internal Medicine found older adults experience significantly higher complication rates after colonoscopy procedures, including dehydration, bleeding, cardiovascular stress, and bowel perforation. Now imagine this for a moment. A 79-year-old woman lives independently. She gardens every morning. She cooks her own meals. She enjoys quiet walks through her neighborhood. She feels healthy. Then one colonoscopy preparation severely dehydrates her body and sends her to the emergency room. Not because of cancer, because of the procedure itself. This is the side of preventive medicine many people never hear about. Sometimes the intervention becomes the crisis. And here's the difficult truth. Some colon cancers discovered very late in life grow so slowly they may never actually affect a person's remaining lifespan. But once something appears on a scan, the medical system usually keeps moving forward. More tests, more procedures, more fear. And many older adults never stop to ask the most important question of all. Will this actually improve my quality of life? Or am I simply entering a cycle of treatment? The second checkup involves one of the most emotionally powerful words in medicine: cancer. Modern imaging technology is incredibly advanced now. In some cases, advanced enough to find cancers so tiny and slow-growing they may never become dangerous at all. Researchers call this overdiagnosis. And according to studies published in the New England Journal of Medicine and the BMJ, overdiagnosis has become a major concern in aggressive cancer screening for older adults, especially prostate cancer and some breast cancers. Imagine a man in his late 70s. He still drives comfortably. He spends weekends fishing. He laughs easily. He sleeps peacefully. Then one routine PSA blood test comes back slightly elevated. Weeks later, he's discussing radiation treatment. Months later, he's struggling with fatigue, urinary complications, anxiety, and poor sleep. Not from cancer symptoms, from the treatment itself. And this is where medicine becomes emotionally complicated. Because finding disease earlier is not always the same thing as living longer or living better. A large analysis published in the Journal of the National Cancer Institute found many prostate cancers in older men were unlikely to become life-threatening during their natural lifespan. But once diagnosed, treatment often followed anyway. This does not mean screening is useless. Far from it. Higher-risk individuals absolutely benefit from cancer detection. But the older we become, the more healthcare must become individualized instead of automatic. The third checkup surprises many people because it sounds incredibly responsible. Routine cardiac stress testing without symptoms. A doctor says, "Let's just make sure your heart is okay." That sounds safe, preventive, logical. But according to the American College of Cardiology, stress testing in asymptomatic older adults often produces false positive results. meaning the test suggests a problem that may not actually exist. And once an abnormality appears, the cascade begins. More scans, cardiac catheterization, possible stents, blood thinners, hospital monitoring. And here's what shocked many researchers. The landmark ischemia trial found that invasive heart procedures in patients with stable coronary artery disease often did not significantly reduce heart attack risk or extend life compared to medication and lifestyle management alone. That finding changed how many specialists think about heart treatment in older adults. Because more procedures do not always mean better outcomes, especially after 70. Sometimes the most powerful protection is much simpler. Daily walking, better sleep, lower stress, blood pressure control, healthy food, consistency. The fourth checkup involves something many older adults fear deeply: falling. Bone density scans are now extremely common, and osteoporosis is absolutely real. Hip fractures can completely change someone's independence and mobility. But many people never hear the full story behind long-term osteoporosis medications. Research published in the Journal of Bone and Mineral Research found long-term use of certain osteoporosis medications may be associated with rare but serious complications, including unusual thigh bone fractures and jaw problems. Now listen carefully to this part. One of the most effective ways to reduce fall risk has nothing to do with medication at all. Balance training. Studies published in the Journal of the American Geriatric Society found Tai Chi significantly reduced fall risk in older adults by improving coordination, stability, and movement confidence. Sometimes the most powerful health interventions are also the simplest. Movement, strength, balance, daily habits. The final checkup is one many people have never even heard about until a doctor suddenly recommends it. Routine carotid artery ultrasound screening. The carotid arteries carry blood to the brain. The idea behind screening sounds logical. Find narrowing early. Prevent stroke early. But according to the United States Preventive Services Task Force, routine carotid screening in adults without symptoms may create more harm than benefit, because many older adults naturally develop some narrowing with age that remains stable for years without causing problems. But once it's discovered, surgery often enters the conversation, and carotid surgery itself carries stroke risk. In other words, the treatment intended to prevent stroke can sometimes trigger one instead. And this is why medicine after 70 requires a completely different mindset. The goal is not simply finding more abnormalities. The goal is protecting quality of life, mobility, energy, independence, clarity of mind, and the ability to continue enjoying ordinary life. Because after a certain age, good healthcare is not just about adding more years. It's about protecting the life inside those years. And before you leave, I'd really like to hear from you. Have you or someone you love ever gone in for a routine medical test and ended up dealing with treatments, procedures, or complications you never expected? Share your experience in the comments below. Your story may genuinely help someone else make a more informed decision about their own health. And if you found this video helpful, subscribe and join our community. Every week we explore the latest research on healthy aging, mobility, memory, medications, longevity, and the habits that help adults over 60 stay healthier and more independent for longer. And in the next video, we're discussing 7 common medications many seniors continue taking every day without realizing they may quietly affect memory, balance, sleep, and energy levels over time. Some of the research behind them may genuinely surprise you. Take care of yourself, and I'll see you in the next video.